Now, on today's show, we're going to talk about, as I mentioned, perioscopy. Now, as I understand it, this is a microscope that gets inside the gum pockets to detect plaque and buildup that causes gum disease. Let's talk a little bit about that procedure. Tell me, how long has it been around, and what is it?
I think it's been in common use for almost, well, I shouldn't say common, excuse me. It's been in use for about a decade. The main etiologic or causal factor of gum disease is the adherence of tartar beneath the gum tissue that adheres to the tooth root. This tartar, as it builds up, it represents a congregation and aggregation of bacteria that, much like the tartar that forms at the back of the front teeth, the tartar you have cleaned off, tartar adheres to the root surface beneath the gum tissue, and what this essentially does is causes irritation of the gums. The gums swell up and form a pocket. As that pocket gets deeper, more and more bacteria aggregate on the root surface beneath the gum tissue. And over time, as the bacteria aggregate and release their waste products into the gum tissue, the bone, the periodontal bone that supports the tooth will start to dissolve away. So the whole process is initiated as gingivitis, that is swollen gum tissue. And as the pocket forms and more bacteria aggregate beneath the gum tissue, you transition to periodontitis, loss of the foundation that holds the teeth tight in the mouth. As you have a loss of that foundation, it just makes a deeper pocket. More bacteria fit in, more poisons are released in the gum tissue, and now more bone loss occurs until those natural normal bacteria we all have in our mouths cause tooth loss. The idea behind this procedure then is to selectively remove the bacterial aggregations from beneath the gum tissue. Conventional periodontal therapy often starts with a deep cleaning or scaling and root planing, which is a by hand, by feel procedure where after getting the patient anesthetized, good and numb, we reach into these pockets and clean by feel. The idea is to move all the bacteria, if we can locate it, beneath the gum tissue. After a suitable amount of time healing, usually 4 to 6 weeks after this treatment, this deep cleaning, we reassess the situation, and any deep pockets that remain within the patient's mouth then go on to gum surgery. The main idea behind gum surgery is, rather than reaching into these pockets and cleaning by feel, what we do now is we get the patient anesthetized again, but this time push the gum tissue back out of the way so that we can directly visualize the root surface. From there, we remove any remaining bacterial aggregations that are on the root, and then often in bottom teeth move the gums down, and top teeth move the gums up, thereby making a deep pocket shallow. The whole idea behind perioscopy, this endoscopic cleaning, is that the endoscope lets us visualize the root surface beneath the gum tissue without doing the surgical access to the site. That is, we don't need to push back the gum tissue from the roots so we can visualize it. We're able to look directly at the root surface using this camera, this subgingival camera. And what this, in most cases, does, a vast majority, greater than 99%, is patients don't need to have surgery. This is, of course, in the context of a patient that does a very good job cleaning their teeth at home and frequent periodontal or maintenance, frequent cleanings. Those that have exhibited a propensity for this periodontal disease tend to get their teeth cleaned every 3 months rather than every 6 months. Part and parcel with the excellent home care and the frequent periodontal maintenance, we tend to keep the patient healthy and stabilized. What happens in a patient who's had periodontal disease is that disease process can always start again. So part of that 3-month cleaning then is assessing the situation and making sure there's not any deep areas that are burgeoning.